A very good afternoon, everyone. I'm Lisa Lord. Thank you so much for joining for this COVID-19 update and media briefing. The Minister of Health and Wellness, the Honorable Ian Gooding-Edjo, the Chief Medical Officer, Dr. the Most Honorable Kenneth George, and the Head of the COVID-19 Monitoring Unit, Mr. Ronald Chapman, will provide some updates, and then we will open the floor for questions. We will begin with the Minister.
Good afternoon to fellow Barbadians and members of the media. 2 weeks ago, January 29th, I had the honor to give you an update on the Ministry's management of the surge in COVID-19 cases. As I indicated then, our relative success in managing the pandemic was due to government's swift yet decisive actions in implementing preventative and protective strategies such as testing, social distancing, mask mandates, and vaccinations. Last Wednesday, the Emergency Operations Center, EOC, met and considered whether any changes were necessary to the Directive Number 2. The EOC comprises the Chief Medical Officer, Deputy Chief Medical Officer, doctors within the public and private sectors, medical officers of health, hospital administrators, and managers and technical personnel, all responsible for Barbados' public health management. The advice of the Emergency Operations Center has always been based on the science and an acute understanding that we have to embrace economic and social recovery in order to sustain growth and development. During the last week, I've attended all 3 scheduled EOC meetings, and based on the criteria, the Chief Medical Officer consulted with me and made recommendations. These criteria are scientific tools and benchmarks used to analyze key trends and changes in managing any public health crisis. We unfortunately lost 291 lives, and this represents a case fatality ratio of 0.9%, which remains lower than the global average of 2.2%. But the range is as low as 0.5% and as high as 7.6%. As a result, the Ministry of Health and Wellness thinks that we have peaked with the Omicron outbreak. The results of these trends indicate that the case count and case incidents are falling. The RE, the ability of the virus to spread, has fallen to 0.94. The positivity rate, which is based on tests done, in other words, the number of positive cases divided by the number of tests done, has reflected a slowing of the positivity rate based on the rolling average. The doubling time, which measures the growth rate, continues to increase. The longer the doubling time, it is indicative of the slowing of the growth of the outbreak. It is important to bear in mind that 75% of all persons tested on a daily basis do not have COVID. As of February 11th, there are 6,980 persons in home isolation, down from a high of 11,000. As I have previously mentioned, the backlog of patient discharge certificates has been cleared and remains current, and the automated systems are up and running. I would like to encourage Barbadians and visitors to ensure their email addresses are accurate to ensure timely receipt of patient discharge certificate. With the outbreak of Omicron, the Ministry of Health and Wellness has recognized that Omicron, while still highly infectious, is far less dangerous when compared to the previous strains of Delta and Alpha, and has also posed less strain on the healthcare system, which was of chief concern. The number of negative outcomes with the Omicron variant has been considerably less compared to other strains. These scientific indicators have informed the recommendations to vary the next directive, which expires on Monday. The new directive will be for 2 weeks. Based on the advice of the Chief Medical Officer, the following changes will be made in the next directive. In order to move the country back to opening while observing protocols, the curfew will be removed. Therefore, with effect from this Monday, February the 14th, which happens to be Valentine's Day, the curfew will be lifted. I'm sure that restaurants and other authorized dining facilities will want to fully cater to the pent-up demand of Barbadians and visitors on this extra special day. Patrons will no longer have to watch the clock. The 6 feet rule will no longer apply except where persons exercise together outdoors wearing a mask. In all other cases, the physical distance of at least 3 feet will apply. Hiking will be allowed in no greater groups of 30 individuals. Pleasure craft and private boats chartered for private cruises will move from 50 to 100% of their authorized number of passengers. Proof of vaccination or testing will be required prior to boarding. The long-awaited dream of returning to party cruises will be realized in a responsible way. Party cruises will be allowed to operate 100% of their authorized number of passengers, subject to proof of vaccination and rapid antigen tests and the presence of an officer from the COVID monitoring unit on board all cruises. The public health officials have indicated that these outdoor open-air events will not pose a significant threat to our public health so long as the protocols are followed. Cricket capacity at Kensington Oval for the upcoming international tournaments will move from 60 to 80% fully vaccinated. There will be no restriction of beach activity and parks, and therefore the 5 a.m. to 7 p.m. guidance shall no longer apply. Barbadians and visitors alike will be allowed to enjoy these facilities without limitation. Public service vehicles will be allowed to increase the authorized number of sitting passengers from 75% to 100% wearing masks and shall carry no standing passengers. When the Ministry of Education settles on students returning to school, the Ministry of Health and Wellness will discuss and agree the timetable for the safe return of community-based events, including sporting events. This is expected to be done in a few weeks' time. The relaxation of these elements within the directive, while giving more freedom to the population, is by no means a signal that the outbreak is over. The further easing of some restrictions is another step of return to life in Barbados as we used to know it and love it. These acts of national relief should hopefully bring about a noticeable reduction in stress and anxiety among the population. Personal responsibility is critical to the protection of yourselves, your family, and workmates. It is absolutely critical that all Barbadians comply with the guidance and protocols given by the Ministry of Health and Wellness. I wish to extend my thanks to all healthcare professionals and frontline workers who continue to go beyond the call of duty for patient care and public health protection. It has been a long and testing road to travel with this ongoing pandemic, but as a small island, our public health officials and institutions continue to serve us well. I wish to commend the people of Barbados as a whole for helping us to make these life-changing and nation-improving benefits possible. We could not have reached this historic milestone without the overall and consistent cooperation and support of the public at large in following the lead and expertise of the dedicated professionals in the health sector and supporting agencies. We are by no means out of this health crisis, but we recognize that we are going to have to live, work, and socialize safely in this COVID-19 environment for some time to come. We urge you to continue with these practical and effective measures for infection prevention and control, such as the wearing of masks, sanitizing of hands, physical distancing, and access to proper ventilation wherever possible. As Dr. Adana Granison, head of the Home Isolation Unit, advised at the last media briefing, I would like to encourage you to stay adequately hydrated by drinking plenty of fluids. Your government has maintained all existing public health institutions added dedicated facilities to protect patient safety and reduce the COVID fatality ratio, and spent in excess of $100 million to meet additional health care costs, purchased and provided vaccines and boosters at no charge to its citizens and residents. We did so at a time when government revenues had fallen sharply due to the severe fall-off in economic activity and revenue from the productive sectors. Notwithstanding what we are faced with, Barbados' political leadership, led by the Prime Minister, the Honorable Mia Mortley, and public health management officials, have kept us safe as we continue to manage our way out of this global public health crisis. We have to continue to be judicious with our approach to the safe and orderly return to full opening of all activities in Barbados. As I indicated earlier, the Ministry of Health will set out a timetable for the safe return to community events, including sport, as soon as we complete the return to school. Let me stress that vaccination continues to be an integral strategy for getting out of this wave. We are expecting 120,000 doses of Pfizer vaccines on February 17th, and we are actively seeking to replenish our stocks of AstraZeneca vaccines. Altogether, we have the outcome of this pandemic in our own hands. I would like to encourage Barbadians to get vaccinated, and for those who are not, to proceed to do so, and for those who are vaccinated to get the booster. I thank you.
Thank you very much, Minister. We now go to Dr. George.
Good afternoon, everyone. And it's a pleasure to be here. I'm in agreement with the Minister of Health's statement. Sure and steady will get us out of this pandemic. We need to be purposeful, and we also need, during the changes, to make sure that all Barbadians protect themselves. I'm happy to report that there is a decline of 19% in newly confirmed cases in the past 7 days in comparison with the previous 7 days. The 7-day cumulative incidence is currently 1,206 cases per 100,000 population. The daily average number of cases is 495, down from a daily average of 692 2 weeks ago. The R effective as of February the 11th is 0.84. However, though there is a downward trajectory in our positivity rate, we would like to see this also improve. Our positivity rate is approximately 23.4%, a decline from a high of 26%. As you know, over 50% of the population has been vaccinated, and with respect to the eligible persons who can be vaccinated, that is as high as 65%. I am pleased to report that the uptake of boosters is improving, with 57% of the eligible population having been boosted. Let me reiterate that the current approved vaccines continue to provide good protection against severe disease and death. How each country responds must be informed by its local epidemiological situation, available resources, impact on the healthcare systems, vaccination status and uptake, and within the wider socio-economic context. It is within this context that I support the changes made to the current directive. As Minister says, we support the changes fully. However, personal responsibility and good judgment are critical for us to get out of this current wave. We believe that based on information that we have based on the disease profile in Barbados, that certainly Omicron is highly contagious, and we are not shying away from that. But fortunately, you have ways to protect yourselves. And in addition, those unfortunate individuals who are affected by Omicron, they tend to have better outcomes and a better course. So I'm asking all Barbadians to continue to have their guard up. There has been some ease, and I personally welcome that. However, we are not out of this current situation, and I really appreciate your further cooperation. Thank you so much.
Thank you as well, Dr. George. We now go to Mr. Chapman.
Good evening. I just want to sound my voice in echo of the support of the Minister and Dr. George. As you would have seen, we would have made a number of changes to the directives, and there are a number of eases within the protocols and guidelines. This, however, does not mean that we have thrown all caution to the wind. Neither does it mean that we as Barbadians should throw all caution to the wind. We must continue to practice our hand sanitization. We must continue to practice physical distancing, and especially the wearing of masks. These things have proven themselves to be effective during Alpha, during the Delta variant of this outbreak, and indeed during Omicron. So we ask that persons, although there have been some eases in the directives, to practice personal responsibility, and as Dr. George says, good judgment. We expect that persons will have lots of questions, and we are here to provide as many answers as possible. We will continue to move deliberately. We will continue to move slowly, incrementally, to ensure that we reduce the level of, that we increase the freedoms or reduce the level of restrictions while ensuring a safe environment. We all welcome these eases. We all welcome a gradual return to the norm. And as we continue as a people to follow the protocols, to act wisely, and as the Prime Minister would say, to lend our hearts to wisdom, we will see a further falling of the cases, and we will also see further reduction of the restrictions. So with those few words, I'd like to say thank you very much.
Thank you, Mr. Chapman. As we open now for questions, as customary, I would like to ask my colleagues before posing their questions to identify themselves and the media house they represent. Your questions.
Hi, good afternoon. Colvin Munzi from Nation News. I have two questions quickly, one for Mr. Chapman and one for the Chief Medical Officer, Dr. Kenneth George. First to Mr. Chapman, given that you are the person in charge of monitoring, does the level of compliance witnessed on the ground at this point justify the changes that we are now being seen brought to bear in terms of the protocols? And to Dr. George, the matrices that would have been used in determining the lowering of the protocols seem to differ from when we were under the Delta wave. For example, the positivity rate, I mean, is still 24%. That's still pretty high. Could you shed some light as to why this is at this point?
Will answer first.
There are a number of things that justify changes in the directive. It is not only compliance, but it is those metrics that Dr. George would have spoke of. It would also be the virulence or the level of danger that Omicron poses to the community. I'm sure Dr. George will deal with those. But to be more direct, yes, there has been over time an uptick in compliance with protocols. It takes a community time to move to change behavior. No one, very few people change behaviors overnight. There usually has to be some sort of major emotional significant event for behavior to change immediately. It takes time. So in the beginning, we saw persons, there were some persons who had been implementing those behaviors immediately, and then we saw some that we had to give them a little nudge here and there. But as time went by, we saw the increase in the wearing of masks. Persons express a lot of difficulty in keeping masks on for a long period of time, and I know there are still some persons who do, but over time we've seen compliance in mask wearing. Persons are far more aware now of how the disease spread, and you can see that in the way they physical distance, although we still have, as you would appreciate, some persons who breach that distance. And in terms of hand sanitizing and the protocols at different business places and so on, we'll see that they are very consistent. So overall, we have seen very good uptake in terms of persons following protocols and guidelines. And let us be straight, this comes down to personal responsibility. This comes down to good judgment. And this comes down to each one of us being our brother's keeper. So as we go forward, we expect that the population would continue to follow these trends.
Dr. George?
Yes, with respect to your second question, we have learned much over the last 2 years. We had Alpha, Delta, and Omicron. And although it is the same virus, even the clinical presentation is different. And not only the clinical presentation, the epidemiology of the disease is also quite different. Therefore, you can't only use a positivity rate as your only metrics. As I have indicated before, the positivity rate looks to be trending downward. We use the term endemic in public health, and endemicity is the term we speak to when disease is within your population. It is being transmitted at a low level, but it is there. It can't be removed. It is not like an acute outbreak. As I have indicated, we are in this for the long haul. And if we are going to say that COVID is now endemic and many persons are getting COVID, we can't run and hide. And therefore, the positivity rate is certainly not the only metric that is used. We would like to see that obviously come down to below 10%. But with the concept of endemicity, there will always be a level of circulation of virus within our communities. And that is for the foreseeable future. And therefore, the changing of the protocols reflects this type of understanding of the public health. As I have indicated, decisions are not made rashly. Decisions are made purposefully, using not only the Barbadian experience, but also using the experience of our international partners to make decisions. Thank you.
Mr. Chapman, you wanted to come back in here?
Thank you very much. I think online a question was asked, and the minister asked me to address it concerning things like choir practice and so on. And the answer to that is yes, persons can return to choir practice. We would encourage, obviously, it means that you will be practicing in mask. The physical distancing will be consistent with what is already there with the 3 feet, but we will encourage, not encourage, we are saying that basically that you will be wearing masks. We have not done away with masks. I want to be very clear about this. Mask, physical distancing, hand washing, those non-pharmacological methods are critical in reducing the risk of COVID-19 spread. So while we have relaxed a number of things, those we are comfortable that these ones that remain in place are sufficient to ensure that we can conduct our business in a safe and responsible manner. Thank you.
Next question.
Hey, good afternoon. Randy Bennett from Barbados Today. At the start of this Omicron outbreak, some forecasting and some predictions were made by the ministry in terms of the number of cases that were expected at the peak of the outbreak. I know that the minister said that we have passed the peak, but I was wondering if there was any information or any predictions as it relates to the number of cases that we expect going forward.
So the information that was put in the public space is called models. Models depend on several. Modeling is not a definite science. It is based on inputs, and you come out with, based on the inputs put into the model, you have a prediction or estimation as to what will happen. Models were put in the public space. However, those are used to internally guide our decision making. The issue surrounding the models is used as an internal tool to guide decision making. We will continue to use those models to make decisions with respect to the public health of our people in Barbados. But I don't want the public to feel that the whole issue of modeling was either sidelined or a model is an estimate, and different people across the world will get different results. So the models are as good as the inputs and the technical capacity to do the modeling at this time. Thank you.
Randy, did you have a follow-up?
So just to be clear, so there has been no estimation by the ministry in terms of what you expect going forward in terms of the number of cases.
We have done estimates, the university has done estimates, and we have also done internal estimates. That's correct.
So go ahead, Randy. Go ahead.
Right, so you have done estimates, the university has done estimates. I'm just trying to figure out, so you can't review those estimates?
Those estimates were put in the public space. I don't have the information.
I'm talking about know that you're saying that we are past the peak of the virus. I'm trying to figure out going forward, what does the ministry expect in terms of the outbreak and the number of cases on a daily basis to be dealing with?
The number of cases on a daily basis fluctuates, and that's why we look at trends over time to get a position as to where we are going. That has been the main use of the metrics that we prefer to use, trends and not daily results. As I said, the models guide internal decision making, and the information I would like to convey to the public is that based on all metrics, we have peaked and we are on a downslope. Thank you.
Hi, yes, Colville Muncie here again. I have a question for the Minister of Health. Now, some departments of the private sector have already indicated that they would be scrapping their plans to push forward for the notion introduced as safe zones. Now, is government still moving forward with this initiative as a national policy objective, as indicated last year?
I'm not going to speak to that right now. Of course, you would appreciate I'm still being briefed. I will be happy to revert to you later in the week in respect of that.
Are there any further questions?
I have one more question.
What I'd like to do is,
Sorry, 1 second.
perhaps Dr. George can speak to this as well.
So the concept of safe zones is an excellent concept and was supported by the Ministry of Health and Wellness. But what the concept of safe zones is difficult to do a safe zone in an environment where you expect a lot of the population being exposed. So the reality of it is that as we knew and understood more about Omicron, the safe zone concept would have applied as a better fit with respect to the Delta outbreak. But certainly with the Omicron outbreak and with so many persons who have been infected, fortunately they're having a good outcomes. The concept of safe zones cannot be transposed into a Omicron environment. And I think that just speaks to the flexibility of public health officials and government officials in understanding that we are dealing with two different issues and we can't transpose the safe zones into an Omicron environment. I think Omicron tells and signals to the public based on its behavior that again, the population has the tools at hand to protect themselves. And it has shifted from a more central Ministry of Health trying to work through the issues with saying the population come on board, understand the principles and try to protect yourself in whatever you do.
Colville, I crossed you just now, my apologies.
I think Randy, I have another question. I think Randy was trying to get in to ask another question. I don't know if he wants to proceed.
Yeah, just one more question from me. We've seen a trend across the world, and it has also reached the Caribbean, where some countries are discontinuing their vaccination programs. I was just wondering from the CMO if Barbados was looking at going in that direction.
So that's not the case. Vaccinations remain a fundamental part of our protective strategies, and that will continue for the foreseeable future.
Yes, on the issue of vaccines, now there has been a lot of push for a return to face-to-face classes, and I would like to ask of the Minister of Health, what type of headway has been made in securing vaccines for those children between the ages of 5 to 12, as that is the area of concern at this point, especially?
I would ask Dr. George to address that point.
So we are continuing to make some progress. We are, as I had indicated, exploring several international organizations and governments. But once we get the vaccines here, we will let the public know and give them the information that is required for parents to make good choices with respect to the vaccines. Unfortunately, the vaccines in children have been limited to some developed countries, and there has not been a push to have those vaccines transferred to the more developing world. But as the Prime Minister has indicated, particularly early in the pandemic, it was a dog-eat-dog world with respect to getting vaccines. And I think on an international stage, they have reached a point where understanding that equity and solidarity are the two major pillars that needs to be promoted with respect to having vaccines made available to every citizen. No country is safe until all countries are safe, and that is still an important concept. Thank you.
Are there any further questions?
Yes, just a quick follow-up question for Dr. George or the Minister, because this might be a policy issue. The receipt of those vaccines that I was referring to earlier, those ages 5 to 12, how much of a determinant factor is this in any return to face-to-face classes in a quick time frame, especially for that age group?
Well, it's not a good measure to institute policy if you don't have the tools to carry out that policy. And once we have vaccines that are available, I am sure the policymakers will make those appropriate decisions. But certainly we are certainly within the Ministry of Health going to make every effort, as we did early in the pandemic, to not only have vaccines available to Barbadians, but also to have choices of vaccines available to Barbadians. And therefore, the vaccines that are currently on the market in Barbados are Johnson & Johnson, Sinopharm, AstraZeneca, and Pfizer vaccines, and they are all available at our sites. So there's so much that we are still learning, and I keep saying that after 2 years. Why? Because we first had vaccines, then we were required to do a second dose, then we were required to boost, and who knows what the future will hold. So it's not a certain science. But the good thing with respect to public health, what I can assure the public, is that we have the flexibility when called upon to make those tough decisions with respect to making sure that Barbadians are safe.
Well, if there are no further questions, Minister, I will give you closing comments.
Thank you, Lisa, and thank you to all Barbadians. What I would like to say in closing is that Barbadians are encouraged to continue to take the guidance and advice from the Ministry of Health. The Ministry of Health has a very competent team, and they go to work every day to protect public health and safety. I would also like to encourage Barbadians to get vaccinated, and those who have been vaccinated to get the booster. I also want to thank Barbadians for their continued cooperation, in fact, their consistent cooperation. The cooperation of Barbadians and following all the requirements of the ministry has brought us to this point. And we are confident that if we are going to arrive through this wave, that their continued cooperation will be necessary. I want to encourage all Barbadians to remain safe, continue to wear your masks, as indicated earlier by Mr. Chapman and Dr. George, the sanitizing of hands, ensuring that there's appropriate physical distancing, as well as to facilitating, wherever possible, as much ventilation. I would also like to say that the work of the ministry will continue, and consistent with what started long before I became minister, that we will continue to communicate with the public as needed. And on that note, I will once again like to encourage Barbadians, even though we have relaxed some of the measures contained in the directive, to continue to do what they've done over the past year and maintain safety within their environment. Make sure you protect your family, your workmates, and other colleagues. I thank you.
Thank you very much. That was the Minister of Health and Wellness, the Honorable Ian Gooding-Edgell. Let me also thank the Chief Medical Officer, Dr. the Most Honorable Kenneth George, the head of the COVID-19 Monitoring Unit, Mr. Ronald